if you would like to introduce yourself, to present yourself.
Yeah, I'm Mzia Kutateladze. I'm director of the Eliava Institute of Bacteriophages, Microbiology and Virology. My background is microbiology, molecular biology. I'm working here many years old. Yeah, I started here after graduation of the university. I took different scientific steps, starting with the lab technician, then senior scientist, junior senior scientist, head of laboratory, head of scientific council, and now I'm director of the institute.
And could you present phages? What are phages for the main public, even for doctors, if you want? I mean, my social media accounts are followed also by a lot of doctors or representative of the health ministry, if you are interested on this target also. So,
yeah, phages, actually scientists know phages more than doctors because most of the molecular biology developments have been made using the phages. So phages are bacterial viruses. It's viruses which kill only bacteria. And actually they're very selective and killing those bacteria that are causing the bacterial infectious diseases. So they're very specific, and this is advantage because they are selectively targeting those bacteria which are disease-causing, and they do not affect normal microflora, which is the main beauty and advantage of the bacteriophages. And based on this property of phage, they have been used for treatment many years already. It's history, it's very long, about 100 years of using of phages. They're different, they live everywhere. I mean, they're the most abundant organism on the planet. So they're living on our skin, in our systems, human systems, everywhere in the environment. So, and they're natural, and we are working mainly on the natural phages, yeah.
What kind of ailments they target? Are they, could we say,
bacteria? Yeah, the different bacteria which are pathogenic. So it means that the bacteria which cause bacterial diseases, infectious diseases, E. coli, Staphylococcus aureus, for example, Pseudomonas are different, Salmonella, Shigella, and different kind of which cause the bacterial diseases. Yeah.
Okay.
So almost every bacteria has its own virus. Sometimes it's easy to isolate, sometimes it's not easy to isolate. So it's, yeah.
I had a little question. Why choose phages over antibiotics? Are they complementary or?
Yeah, it depends very much, you know. Sometimes in the chronic patients, we are using it together in combination with the bacteria, with the antibiotics, any other antibacterial, not only antibiotics, there are other antibacterial remedies, and this is the maximum efficacy of the phages. It's with the combined use with antibiotics or other antibacterials, because the mechanism of action is different. But we have cases when we have complete antibiotic resistance, especially now because this kind of case is increasing globally, not only in developing countries, but in many. It's a global threat and global problem. And in those cases where you have complete antibiotic and antimicrobial resistance, it is very effective to use the bacteriophages alone. So in the chronic patients, in the immunocompromised patients, and different also.
Do you have patients all over the world that are coming here?
Yeah, well, actually this phage treatment, which was provided by Institute, has a very long history. And we have patients right now. We have Phage Therapy Center, which is kind of spin-off of the Institute. And we are offering our service to the different international patients, and geography is very wide, yeah.
And these patients, they should come to your to address your center, or are there any other?
Yeah, and the first, so the center is providing two types of treatment service. Let's say so treatment service. So the patients can come here on the site in our phage therapy center, or we also could provide distance treatment, kind of or remote treatment, but with our consulting all of our doctors and. All necessary investigation. For example, they have to send us the bacterial sample, what is the causative agent of infection, and then our doctors will provide some service, some medical consulting and treatment regime, etc., etc. Yeah.
This treatment, there is a minimum period of
treatment. It depends. It's very personalized. It's very personalized. In general, we are saying that the maximum it's 2 weeks, but in some cases, when it is acute infection, you have efficacy during first 5 days, 7 days, when it is acute problems. But when it is a chronic patient and with, for example, deep wounds or different kind of, it's a very, very specific and very personalized. In that case, you have some period, 2 weeks, for example, then if it is needed to repeat the phage treatment, then you have to have phage-free period. So the patient should not take phages for 10 days, for 2 weeks, and then again they have to repeat it. So it's a kind of procedure time, yeah.
I know that the phages are addressed to adults, but are they suited for children too?
Absolutely, absolutely. We have very many publications by the Institute where doctors have been used it in the newborns as well.
Okay.
Yeah, otherwise the immunity very high, the phages working very well, yes.
Usually what kind of...
It's kind of bacterial problem. Sometimes it was sepsis.
Okay.
Bacterial sepsis. Right now, we are not using intravenously, but during the Soviet time, it was used for sepsis intravenously. Yes. So different kind of bacterial, intestinal problems also in the children and also adults, of course. And we have the phages which are already ready with the fixed composition. It is possible to buy it in the pharmacy in Georgia. And it's a kind of phage mixtures for the different kind of infections. So it's a ready-to-use problem, ready-to-use phages. But first, the patient should know what kind of bacteria they have and also susceptibility, how susceptible this bacteria is to the phages. So we are doing it on site here in the laboratory, diagnostic laboratory, and then doctors are selecting which phage they can give to the patients, yeah. And so I'll follow others.
Other phages impact the body's good bacteria?
Impact? No, because they're very specific. I already mentioned that they target only infectious causative agents of infection. They're very selective. They do not affect like flora, no.
Are there more specific elements that people come to treat here? I mean, they come for dermatological or just for septic? What are the main problems they are seeking to resolve here?
It's different, very much different. The people who are coming to us from abroad, from different countries, it's mostly the urinary tract infections, with the chronic infections, chronic infections, the long-standing infections. Sometimes it's a respiratory infections. Sometimes it's a secondary infections which are associated with some genetic disorders, for example, cystic fibrosis or other genetic diseases. Also some digestive problems, irritable bowel syndrome, etc. So it's different. All for Georgians, of course, it's for the acute infections because for acute infections it's difficult to travel to us, but it's mainly for the chronic, for the foreign patients. But here it's a different acute and chronic also. Yeah.
I have another question related to this one. How long have patients usually been battling their infections before they find you? I met someone here that said that she was suffering from urinary infection for more than 12 years until she came to you.
Yeah.
So,
it's very much depends, So now it's very easy because it's we have many patients already treated. The phage therapy center is operating since 2010 or 11, so it's quite a long time. And then we have patients who have special blogs or special platforms, they're communicating with each other, and now it's easy to find us. And we have some TV programs also in the different countries, and whether BBC or Dutch or German TV or radio. So more and more people know about us. Of course, it's kind of a lack of knowledge, because sometimes people do not know. Sometimes they're thinking that, how it can be treated with viruses and etc. But our patients sometimes, you mentioned 12 years, then we have the people with the more, than 10, 12 years of infections. They have tried a lot of different approaches, nothing helps, and then they are coming to us. So we have this, a lot of very severe infections with the long-standing, the chronic infections, and they're finding us, yes.
okay. I think I asked on the question time was phages for people allergic to antibiotics are a safe alternative for patients that can
Absolutely, because phages do not have any side effects, any major, no allergy, no toxicity. So it's the only thing. You have to down-select. I mentioned that this bacteriological analysis is necessary, yes? So you have to find active phage. If you have phage, it will work very nicely and it will not have any, and the patient will not have any side effects. Sometimes it's very difficult to find the phage, but our institute is very important for this regard, because we have almost 100 years of know-how how to find targeted phage for the different infections, We are preparing phages for individual patients. So I mentioned the fixed product phages, which you can find in the pharmacies. But in case this fixed product do not work for the patient, then we are preparing exactly for this for this specific patient to use. So this is really very, very important,
If there's something else that you would like to add, something that
So it's very safe treatment. It is not. It's very safe, and again, it doesn't have any side effect. Our team is very professional experts on how to use phages, how to select the regime of treatment. So we have quite an experience in this regard. So we would be happy if you have some patients, or there are some patients who are seeking some help with the chronic infections or some multi-drug resistant infections, we might help those people.
This is actually my intention, to make public about Eliava Center and to facilitate them to reach you.
So now it's very easy. I mean, somebody's calling.
Please.